Okay, we're slowly filling up here. My name is Dr. Paul Herkel. I am a naturopathic doctor and I'm going to be leading the webinar. I have a couple colleagues that are helping me. Cameron Cogswell is one of them. You can see him on the screen there. And also Sophie Mersard-Royd is going to be helping moderate, and they are panelists for our discussion. Cameron, can you hear me there?
You bet.
Okay, wonderful. Okay, we're going to get rolling here. And we're going to kind of get started. Cameron, do you want to say a few words before we get started?
For sure. I'll just be acting as a panelist, like Dr. Paul said. I mean, we're really excited about this. Dr. Paul is a wealth of knowledge. We've known each other for quite some time, and he's wonderful. So we're happy to answer questions. This webinar is going to be very informative. There's going to be a lot of information. So, if there's a question you might have, throw it in the chat. He's not going to be monitoring it. That's what I'm here for. So I'll see what's going on. If there's some repeat questions, I'll narrow them all down. We'll ask Dr. Paul at the end, then he'll go over them. But it should be straightforward, very informative, entertaining, and I think you'll get a lot out of it. So we're very happy to have everybody here. And like I said, just throw your questions or comments in the chat, and I'll refer them to Dr. Paul at the end.
Perfect. Okay, let's get rolling. We have a lot, as Cam said, we have a lot to get after today. I really want to make sure we give ourselves enough time. Cameron, if any technical issues, feel free to interrupt, and we'll kind of correct that. But thanks everybody for being here tonight. Like I already said, my name is Dr. Paul Herkel. I'm a naturopathic doctor. Uh, Obviously, this presentation is meant for your educational purposes. This is not something that I can help you with personal questions. So if you have questions specific to health conditions that you might have, you can use the information that we're going to be talking about today, but I can't specifically answer those. General questions about some of the content that I've presented and I will be presenting absolutely are welcome. Hopefully, we'll have some time to take some of those here at the end. And then of course, as I mentioned, I am involved in a couple different things. I'm a scientific advisor with Aqua Omega, who is the sponsor here of this webinar, along with Healthy Planet. And I also am heavily involved in the chronic pain space. I have an office in the Vaughan area where I see chronic pain, neurological conditions. So this topic today is right up my alley, near and dear to my heart. So let's get rolling. Let's think about this for a second. I kind of want to take you on a story, on a journey today, because everybody, I think, would agree that we want to have optimal mood. Let's take a moment, just think about what actually impacts mood. And now you're probably thinking, a lot of different things. I'm going to be talking about a whole bunch of them today. Definitely not exhaustive in terms of what I'll be covering because there's many, many different factors. But I kind of want to bring it back to you for a second. Think about the times that your mood isn't the greatest, and I want you to think about what impacts your mood specifically. Is it I'm tired? Is it stress? Is it that time of the month for women that are menstruating? Maybe it's your mood changed after menopause. Think about all the things that are impacting your mood. Most often, we can probably deduce back down to these three areas: deficiencies, excesses, and hormones. These are what are called metabolic root causes. What that means is that these are things that are happening inside of your body, whether it's from do I have enough building blocks on a nutritional level? Do I have too much of something, which we'll talk about? And then we're going to finish up by talking a little bit about hormones. Hormones are kind of what makes all the functions in your body work together in synergy. Now, there are some things that these three areas don't cover. They're obviously more modifiable, which is why I want to focus on them. And they're definitely in the space that we're really interested in when it comes to our nutrition, metabolism, and how our cells are functioning. But there are some non-metabolic things like actual mental emotional traumas, genetics, family history, learned behaviors, and thought processes. I'm not a psychologist. There are a lot of things that a psychologist could add to this conversation around feeling focused, feeling calm, feeling energized. That's what we're trying to achieve today in terms of understanding. So let's get right into it. I'm going to start off with introducing you to one of the key players in this conversation. We kind of need to know what's going on when it comes to actually how our nerves communicate. Because if we break this down to a cellular level, you're going to see that there's a lot of complicated things here. And I don't want you to memorize any of this, but I do want to point out one of our friends here that plays a central role, and that's called the mitochondria or mitochondrion. Now, why is this important? Your mitochondria are the power plants of your cell. When they're functioning, you have enough energy, you have focus, you have balance in the way that you're thinking. There's a large amount of key ingredients that go into making the mitochondria function. Nutrients, minerals, vitamins. I'm going to talk about a whole bunch of them today. But again, not an exhaustive list, but understand that they require high level of nutrition. The most important nutrition is actually not something you could eat. It's something we breathe. It's oxygen. That's one of the key things that are going to keep mitochondria going. That's why if we don't breathe, we pass away. And obviously, if there's a lot of things that are impairing mitochondria, and then if you don't have good mitochondrial function, you won't have energy. So let's look at the things that kind of the ingredients that go into the production of this ATP. This is our energy currency. It's the it's the bucks of our body that are going to buy things and make things function. So I mentioned oxygen, but there's also fuels. So good fats and primarily sugar. So you and I are sitting here listening to this conversation. We are using primarily sugars to function. But as our energy expenditure goes up, let's say if you went for a jog, now I'm going to be starting to use different types of energy. So that does change over time. Nutrients, we'll talk about some of these. Note that even hormones such as thyroid hormone also plays a role here. So what about, can we just boost mitochondria? Is there a supplement that just like blasts the mitochondria and helps it do better? The reality is that uh, there isn't. There's many things that help it work better, but there's many things that actually will decrease mitochondrial function. This is why it's not as easy as like taking a drug or a supplement that just makes mitochondrial function work more. First thing is lack of oxygen. We'll talk about that in a second in the deficiencies very briefly. Fuels. Are we getting the right fuels? Do we have excessive sugars? Is there inflammation that's happening? Deficiencies, I already mentioned. Infections, viruses, and bacteria. This is an interesting one. Flu season's in full effect right now. First thing that happens when you get the flu or a viral infection, you start feeling tired. That's because the inflammation that the virus or bacteria creates actually decreases your mitochondrial function. This is by design. The body's actually quite intelligent. It doesn't want you running a 5K and getting stressed out and going to work. It wants to focus on recovery. So it's actually a built-in mechanism to slow down. But what if that continues? Now, there are post-viral issues that are dealing with. We definitely found that out through COVID. So there are things that we can do to help support the recovery, but a lot of the building blocks are listed here. Inflammation plays a key role in mitochondrial function, and finally, hormonal system. So really what I want to do is I wanted to zoom in, look at the actual thing that is regulating our mood and our energy and our focus. And then now we can kind of zoom out and look at a whole bunch of things that actually contribute to this. And this is another way graphically to look at this. It's more or less the same thing that I just talked about. They're all interconnected. It's none of this stuff happens in isolation. If you are having an impaired digestive system, you're not going to absorb your nutrients. So you have to look at this not in, one thing, I just got to correct it. We have to start looking at, why am I maybe not getting enough of these particular nutrients? So I want to start off with the excesses. And just note, again, I'm going to reiterate this. It's not an exhaustive list of these. There is a whole bunch of excesses you're going to see. I've listed a number of them. These are things that we have to reduce. Inflammation. I could do a whole two-day lecture on inflammation, but we're going to look at a couple key things. One of them is, are you exercising? Are you able to move your body? And so that's where the macro function, I see this in my office all the time. If a person's in chronic pain, constant dysfunction, then you're not going to be able to move your body well. And ultimately, your body is not going to be able to produce energy as well because when you don't use it, you do end up losing it. And that actually happens on the level of mitochondria too. So getting any sort of physical impediment corrected is an absolute priority. Now, sometimes we have limitations like injuries, motor vehicle accidents, but a lot of people, honestly, in my experience, they kind of let things slide for a long time until it becomes really chronic and then it's much harder to deal with. So a good wise thing to do is any sort of issue you might have, you know what, that knee's bothering me, don't just ignore it. Actually get it looked at. Go to chiro, go to physio, go get that proper assessment, figure out why that's happening. We're going to talk a little bit about uh, the sugar side of things, and I really want that to be a priority. I don't have time, unfortunately, to look at all these different things. We just don't have the bandwidth. But I want to go in and look at a couple key factors. Number one, inflammation. This webinar is all about mood, it's all about cognitive function. And so, what we do now know, we've known this for almost a decade, is that cognitive dysfunction, anxiety, worry is actually linked to inflammation. This is a really dramatic finding. A lot of people don't actually realize that. They think of inflammation as my joints are hurting. I have redness, I have swelling. Those are the cardinal signs of inflammation, but that same thing on a very cellular level is also impacting your mood. So we have to reduce inflammation. We know that stress is one of the ways that can actually lead to inflammation and that ultimately can even lead to depression. This was a big finding, again, about 10 years ago. One of the biggest sources of inflammation is ultra processed foods. That's the fancy way of saying junk foods. And so you can see here, there's a whole host of different things that ultra processed foods lead to. The blue circles are gut dysfunction. The yellow circles are things that are toxins that build up. Foods that are ultra processed usually come in a lot of packaging. They're prepared in ways that can be preserved on the shelf for a very long time. But the downside of that is that it is rich in some of these things that we don't want to have in our body and does cause inflammation. And ultimately, things that it's devoid of is nutrients, good quality proteins, and has lots of sugars in it. So, this is what researchers have found to actually increase inflammation and induce things like depression and change the volume of your brain. This is shattering. This is a 2023 paper showing that ultra processed foods actually induce mood changes. So sometimes in my experience, it's not some real sinister thing that's going on behind the scenes that's causing this inflammation. It's as simple as what are we putting in our mouths on a regular basis? Just to give people a practical idea, I think everyone understands that soda is ultra processed, where something like water or fruit juice that's actually fresh pressed would be something that would be the least processed version. Obviously, there's a whole bunch of things you can see here on the list. Making your own chicken versus buying fried chicken. What makes it ultra processed? The way that it's cooked and the oils that it's used for cooking. The protein ultimately is the same. It's the preparation of these ingredients. Usually there's multi ingredients in these ultra processed foods. And a big giveaway is that if it can last for a really long time on the shelf, the greater chance that it's going to be ultra processed. I want to talk to you about a concept called dysglycemia. This is what happens when a person eats a lot of high sugary foods. So let's look at this graph here. Here's your blood sugar levels. You want to keep your blood sugar levels between these two black dotted lines. And when the blood sugar level goes up, which is this orange line, your insulin has to work on it. And if that continues to be the trend every day, multiple times a day, a person might have like a can of pop with their lunch. You're going to have a big blood sugar spike. Insulin's got to bring it down. And then there's a big dip. We all know this. Kids get a sugar rush at Halloween, and then they have their mood that actually is totally disordered. They're bouncing off the walls. This can actually happen to a lesser degree in adults too. So it's not the problem is the high blood sugar spike because the insulin has to work overtime. But then there's also the reflexive low blood sugar, and that low blood sugar can also cause mood issues. And that's what I'm detailing here. It's actually a stressor to your body. Your body has to create a stress response by increasing cortisol, and that can lead to symptoms like anxiety. So if you're somebody that if you feel really badly, if you skip meals, you have to constantly be snacking throughout the day, you notice that you get hangry maybe. And I've had lots of patients that we've had to wean them off this excessive sugar roller coaster, and that leads to a more balanced energy throughout the day. So that's point number one for us, how to stay happy, focused, and calm. The solution here, as I'm going to show you, is having adequate protein and good fats with each one of your meals. Fiber can also be thrown in there as well, but we really want to minimize these blood sugar spikes. And we've known this for thousands of years. This is the father of modern medicine, Hippocrates, back from ancient Greece. And he was the guy that said, let food be thy medicine and medicine be thy food. But he also said, diseases begin in the gut. There's research now proving all this stuff. So this guy actually was way ahead of his time. So your plate should look like mostly should be plants, could be steamed, doesn't always have to be raw vegetables. Then you're looking at having a good amount of protein in your meal. So a good rule of thumb is at least 1 gram per kilogram of your body weight. And then you're having a minimal amount of uh, ultra processed foods and refined carbohydrates, which would be something like a whole bunch of bread or a whole bunch of pasta. Again, there's healthy versions of that, but in general, we have to be careful with not causing big blood sugar spikes. Here comes the first supplement that I really like. And so I'm going to be sprinkling in what I think I see really good results with in my practice. Holy basil is one of my favorite herbs. It comes from the Ayurvedic line of medicine. It's known as Tulsi. Maybe you've heard of it. It's actually a common tea that's used traditionally in the Ayurvedic or Indian line of medicine. And it actually has a really neat constellation of actions. One of the most well-studied actions is it lowers blood sugar. So it addresses the blood sugar insulin axis, which is called metabolic syndrome. It has anti-inflammatory effects and it has mood balancing effects. There's human clinical trials published on each one of these areas. And so there are supplements, there are liquids, tinctures, capsules. You can do a dried herb or you can do a liquid, or you can use the tea. The tea is, I would say, the gentlest action. This is a herb that I would consider kind of a longer term use. And you do have to take it consistently over a number of months to get the beneficial effect. One of my absolute favorite herbs to address blood sugar, and there are many other things as well. We don't have again the time to go into each one of them. Just I've listed a couple here. Don't underestimate the effect of good quality fiber, both soluble and insoluble. Something as simple as psyllium or something like inulin or hydrolyzed guar gum. Those are all different types of fibers. They are really good at balancing your blood sugar. We've all heard of cinnamon before, chromium, bitter melon, etc. They can all be taken as supplements. Talk to your naturopathic doctor if you're struggling with blood sugar to see which one is right for you, because there are some medication considerations with any supplements as well. Okay, so that was the excesses. We kind of got a little snapshot of that. Now let's spend a bit more time and look at deficiencies. I think this is where we can really get into some good details. And so this area, as I was making this list, I mean, I feel like it could have kept going. Like we unfortunately live in a world of excesses and also deficiency. We're not getting enough here. And so oxygen breathing, something as simple as that. I'm going to talk about hydrations, nutrients, vitamins, minerals, and light in more detail, but I won't have time to talk about sleep. If you're not getting enough sleep, if you're not getting 7, 8 hours for most people, if you're going to bed really late, if you're using screens late at night, you're disrupting your deep sleep patterns. Again, sleep is so important. Don't have the time to get into each one of them. If you're not sleeping well, you're not going to feel focused. You're going to feel like you have poor energy. But all the things that I'm about to talk about is going to be helpful for regulating sleep. I'm not going to have a chance to talk about movement. And obviously, in the psychological realm, isolation is one of the biggest issues that is worse than smoking in terms of its actual detrimental effect on health. We learned this, unfortunately, through the whole COVID pandemic, where people were isolated and suffered for it. Won't have time to get into that, but just know that that is a deficiency. So don't think of deficiencies as, what vitamins am I missing? Yes, I'm a naturopathic doctor. I'm going to talk about that. But there's also many other things that are absolutely fundamental for function that are not always in the vitamin mineral space that are really important to optimize. Okay, so we're going to talk about these four that are highlighted. Very briefly, hydration often gets overlooked because we want to move on to the kind of fancier things like what vitamin I need to take. But don't discount how important hydration is. Something as simple as optimizing hydration makes a dramatic impact on things like mood function and pain levels just by getting at least somewhere between 2 and 4 liters a day is the optimal intake. And that's what I want to share here with you. This little excerpt here, which talks about chronic subclinical low dehydration or hypohydration, it showed that when your serum sodium levels, which is a way of measuring how hydrated you are, the lower water you have, the higher your sodium levels go up. Uh, the more problematic and the more detrimental that happens. You're going to have issues like, for example, dementia, heart issues. Your heart has to work harder when you don't have enough water. Your body will get used to not drinking enough. Now, that's something that's we don't want to have. So we actually need to retrain our bodies in many ways to hydrate enough. So that means sipping water throughout the day, not chugging it in one shot. Also beware of things that are dehydrators. There are things like alcohol that are really problematic. I've listed here some of my favorite options. I think spring water, looking at things that are in glass like this rather than plastic, that water can have things like microplastics in it. Microplastics, by the way, is one of the biggest things that is going to be coming up in I'm going to predict in the next 10 years as a big issue with brain function. I've listed one publication, there's many others, showing that microplastics can cross the blood-brain barrier, increase neuroinflammation, disrupt neurotransmitters, and there is every year we accumulate something like 20 credit cards worth of plastic in our bodies, uh, spoons worth, like large amounts. And so these are things that we can try to minimize. So take a look at this. I'm not going to go over each one of these. I will say you might be looking at this and being like, oh no, I'm drinking distilled water or tap water or bottled water. Listen, drinking that is better than not drinking it. So I'm going to say maybe aim for in 2026 is having some of these other options, but there are better options and then there are less ideal options. So we're always trying to level up here. But even though you may have be drinking bottled water, do your best with what you have. Something as simple as like a filtration system, like a Brita or a Sativia or Berkey. These are all filtration systems that you can buy that you don't need to install. Something like a reverse osmosis system, which would be something that you actually have to install under your counter. Okay, so let's pivot to nutrients. We're going to talk about 4 key neurotransmitters. Now, neurotransmitters, before we get too fancy, it's just simply these are signaling molecules in the brain. Your brain uses these neurotransmitters to optimize its function. So here's serotonin. I hope most of you have heard of serotonin. It's your kind of happy neurotransmitter, but it also does many other things like it regulates your blood flow. That's actually how it was discovered. Most of your serotonin's actually produced in your gut. So there are cells in your gut lining that is producing 95% of your serotonin. And that's because it regulates bowel function, it regulates blood function, but it also regulates your feeling of feeling happy. It helps you stay asleep overnight. But what I want to show you here is there's pathways from tryptophan to 5-HTP to finally serotonin and melatonin that require all these trace minerals and nutrients, magnesium, vitamin C. This is folic acid, B6, B5. And I'm just going to keep showing you dopamine. This is huge now in the online space and the research. There's many things that are stimulating dopamine excessively. So we've always known things like drugs and alcohol do that, but then to a lesser degree, sugar, emotional eating, screens, doom scrolling, binge watching shows. These are all things that are very dopamine stimulating. And again, if we're using a lot of it, well, we're going to be using a lot of these building blocks. Here's the usual suspects: iron, folic acid, B6, magnesium. Same thing with producing GABA, which is your main calming neurotransmitter. So if you're having issues with anxiety, GABA is helpful. In fact, you can actually supplement with GABA, and there is some benefits in having a calming effect. Unfortunately, you can't supplement with dopamine or serotonin. You can take certain nutrients or medications that help increase some of those. And then finally, your memory neurotransmitter called acetylcholine. It does a lot of other things in the body too, but it's also really focused um, on brain function, particularly the memory side of things, and it's very fat dependent. So choline's very helpful. So that gives you a really basic overview of these key neurotransmitters. The takeaway point from this slide is that you need nutrients for these key neurochemicals to function in order for you to be focused, in order to be calm, in order for you to be energized. You need all of these transmitters. So you need all these neurotransmitters, but also all the key things that go with them. So I want to talk about five key foundational brain supportive nutrients. And I've summarized this here. So if you want to go back, watch the recording, I'm going to leave it up here for a second. We're going to go into each one of these in more detail, but this is the summary right here. Take a snapshot, get your phone out, take a picture of this right now if you want to remember this. I do talk a little bit about some of the dosing here. I will mention here in a second, but we're going to go through each one of these in a little bit more detail because they do play a really, really key role in brain function. So let's talk vitamin D. So here's a quick little research. I'm a big evidence-based guy, but I'm also not someone that just talks only research studies. So bear with me as we kind of understand some of the evidence, but then we kind of bring it back into practical terms. We know that most of the research on vitamin D is positive, but there are some conflicting studies showing there's different dosing. Maybe that's part of the problem. Um, One of the key takeaways here is that if you're deficient, you are going to get more greater chance of depression, particularly 3.5 times greater risk. And there was a very recent meta-analysis, which is like a summary of all the studies that have been done. And they found that there was a significant reduction in depressive symptoms after supplementing with vitamin D. But it seemed like there is a level of vitamin D that you need to actually get fully benefit. So this is, again, we're still fully trying to understand this. It does say it needs to be over 50 nanomoles per liter. That's the Canadian nomenclature. By the way, the cutoff point to be deficient in Canadian labs is 75. So ideally, we want people to be over 75. And ideally, even for my patients, I like them over 100. The doses in studies, massive variance, anywhere from 1,000 to 150,000. Now, Health Canada says 1,000 IUs for most people, and that's good if you are not deficient. If you're deficient, now you need higher levels to optimize those levels. The simplest thing I can tell you about vitamin D is get tested. Most people with vitamin D issues, their family doctor says, well, you know what? Don't worry about testing it because everyone's deficient. Right. Okay. I don't disagree that most Canadians are deficient. However, how do I know that the supplementation I'm taking actually is raising my levels? There's a lot of examples of people that are still taking vitamin D and they're deficient, they're still deficient. What's up with that? Well, now it's a absorption problem. Maybe the supplement that you're taking is not actually potent enough. Vitamin D is notorious for having bad stability. So things you can do to help that on a practical level is get tested, then get retested after you're supplementing to see if you are actually raising your levels into the optimal range. Look for a fat-based or an oil-based formula, whether it's in a soft gel or a drop. And then sometimes people will take a large dose at one shot. I think the weekly, regular, or daily supplementation seems to be beneficial compared to one mega dose because now you're putting all the eggs in one absorption basket, and that's maybe not going to work out well for you. So here are the ranges. Over 75 is where we want to be on Canadian values. Okay, let's move on to magnesium. And it's important for us to understand that there's a lot of things happening in the way that our brain communicates. We talked about mitochondria, but now there's these actual signaling molecules that are happening. And magnesium plays a key role in regulating that. In fact, one of its key roles is that it decreases the overexcitability. There's a lot of people that just feel like they're in fight or flight mode all the time. Magnesium actually is a bit of a brake on the brain. So when you don't have enough magnesium, you may not be able to bring on this brake. And magnesium comes in and actually decreases the excitatory or the overexcitatory function. And this is a particular excitatory receptor called the NMDA receptor. And magnesium sits right in that receptor and prevents it from being overstimulated. It also is a key cofactor in the production of GABA, which is our calming neurotransmitter, along with B6, like we just found out. There's lots of research showing magnesium has been linked to anxiety and depression. So if magnesium levels are low, depression and anxiety is higher. B6 seems to be synergistic. That makes sense. We just talked about it mechanistically, how important those are. And so, generally, a strong association with pain issues, with psychiatric disorders, and seems like depression has the strongest evidence for that. On a practical level, there's lots of different ways of getting magnesium. Unfortunately, our foods are pretty depleted in magnesium. There isn't a great food source. Pumpkin seeds, I would probably say, are the best. So that sometimes can be a helpful thing. Supplementation is pretty inexpensive and you have lots of choices. The main takeaway I would tell you is that avoid magnesium oxide unless you're super deficient. A lot of companies will put magnesium oxide as a cheap form of magnesium. It's good as a laxative, not so good at optimizing brain levels of magnesium. That's where I would be looking at some of the things that are further down this chart, like magnesium glycinate, or one of my personal favorites, magnesium L-threonate. There's lots of different ways of getting it, whether it's a liquid or a capsule or a powder. None of that really matters as long as you're getting the right dose. And the research shows somewhere between 2 and 400 milligrams. Always talk to your naturopathic doctor to figure out which dose is right for you. Generally, magnesium is extremely well tolerated. Okay, we got to talk a little bit about omega 3s because they also play a really key role. Remember, we talked about inflammation, and omega 3s play a really key role at regulating inflammation. So, I'm going to show this really neat way of thinking about inflammation. We think about inflammation as this big bad thing that we need to resolve. That's actually not totally accurate. Look at this chart up here. Here's acute inflammation right here in red. Acute inflammation is a healing process. If I bump my knee or hit my head, even sustain a concussion, which is what I do a lot with my patients, your body's trying to heal itself, so it's increasing inflammation. But the whole idea isn't for inflammation to go on forever, it's to stimulate healing and then move on to resolution. Omega 3s are so important in optimizing resolution of inflammation. The problem isn't acute inflammation, the problem is chronic inflammation. And that's where this little bottom arrow goes to unresolved chronic inflammation. So many chronic health problems are chronic inflammation driven. Omega 3s, when you have enough in your body, when you have enough in your blood cells, when you have enough in your cellular membranes, it's going to help resolve these inflammation. And front and center is the key component called DHA. There are two main components, EPA and DHA. DHA, when it comes to brain structure, so now we're talking about the actual neuron itself, it's the main component. 60% of your brain is fat, and 20 to 30% of it is actually DHA. So it's pretty darn important. Really key at resolution. Just to give everyone a little bit more of a schematic, don't worry about some of these light blue boxes. They're too complex. But I want to talk about there's lots of different ways of getting omega 3s. These are all plant-based sources. So linoleic acid is flaxseed oil and is found in some other vegetable-based oils, like for example, canola oil. But the problem is that it's very poorly absorbed. This arrow right here is like a trickle. Maybe 5% of it gets properly absorbed. Before, what we really want to get to is we really want to get to this one right here, DHA, and we want to get to the eicosanopentanoic acid. That's EPA. Now, if you take fish oils, you bypass all these steps right here and you go right here, boom, boom, and then it gets right here into the brain for proper inflammation control. You can see anti-inflammatory effects, neuroprotection. It improves brain recovery and repair. That's called synaptic plasticity, and ultimately neurotransmitter function. This is the summary of how omega 3s work, but I really love graphics, as you can tell, because it gives us an idea of how we can actually kind of like systematically get it into our brain. What's the research say? Again, much like vitamin D and magnesium, very strong. What's unique about the meta-analyses about omega-3s, and I picked depression, I could have picked anxiety as well, but I would say the research on depression and omega-3s are really strong. I could have talked about omega-3s and brain injury recovery. I present on that all the time, but just for the sake of time, I picked mood because that's again the main focus of our webinar today. It seems like EPA rich formulations demonstrated the best benefit, where DHA, great for my brain concussion recovery patients, didn't have as much of a benefit on depression. Why? Well, concussions, like what I treat, that's a structural problem resolving things like inflammation, but also some of those repair things like synaptic plasticity, where we talked about right at the beginning of the presentation, depression is an inflammatory problem. EPA is a great anti-inflammatory. So I think that's why the EPA rich omega-3s are the best option for depression and mood. Most standard omega-3s have more EPA than DHA. So I think you're pretty safe with those types of formulations. What about the dosing? There's lots of research being done on that, but what I want to show you basically is showing that the high dose omega-3s versus the low dose, high dose was what they classified over 2000 milligrams, seem to have a superior effect on mood. Okay. This is a key point because most Costco based supplements you're going to go grab don't come anywhere close to 2000 milligrams of overall omega 3s and definitely not close to 2000 milligrams of EPA. So, one of the second or third key takeaways we talked about so far is you got to get the right amount of omega-3s to get the right benefits. You're looking for EPA here. What about some general recommendations? Because omega-3s actually, the more I learn about it, the more I realize there's actually a lot of nuance, there's a lot of details that make a pretty big difference. First of all, there was a lot of talk probably 10, 15 years ago that omega-3s can mess around with your bleeding and cause you to bleed out and issues with surgery. That's actually been totally proven to be not a problem. A very recent study, 2024, showed that there was no issues on bleeding risk. That's the number two citation right here. And so there might be issues if you're on blood thinners. Always talk to your healthcare provider and your pharmacist, your naturopathic doctor. I always say supplement literate healthcare provider. Sometimes the knee-jerk reaction by medical doctors is just avoid it totally, and that may not actually be in line with the recent evidence. In terms of dosing, look at things like liquid caps versus soft gels versus liquid. Both of them are good. Again, as long as you're getting enough. There's a lot of poor quality products in terms of the potential for adulteration, heavy metals, PCBs. You really want to have a very, very high quality omega-3 to minimize this. We'll talk about the form in a second. And when you store omega-3s, once you open them, I always recommend put them in the fridge, keep them away from light. You want to minimize the oxidation. So let's just take a look at this label here. So what things can we jump out right now? Why is there vitamin E in omega-3s? Some of them because it is put in there as a protectant to prevent that oxidation. Still keep it away from light and heat. Right away, you're taking a look at EPA. You're getting 600 milligrams and you're getting DHA. So this would be an example of one that doesn't get near that dose to improve depression and mood. That's one of the key reasons some people take omega-3s and they're saying, I don't really notice a difference. Well, because they may not be taking enough. And note that this is per two soft gels. The thing that I starred at number 5 over here, this is reported as ethyl ester. Ethyl ester is a type of fish oil that is in a form that is synthetic. It is not the form that's found in your body. This graphic shows you the differences between triglyceride and ethyl ester. Triglyceride, it's the way that it's in the fish, it's the way that it's in our body, it's highly stable, and it's very absorbable. Where ethyl ester, it's put in these ethyl ester forms because it's convenient for the manufacturer, because when they use chemicals called solvents to pull the oils out and remove the impurities, they convert it to the ethyl ester form. And then some companies will actually keep it like that, or others will actually what are called convert it back to triglycerides. So that is actually a synthetic natural form, and that's still not the optimal form. You want to find ones that are in the natural triglyceride form, and that ultimately is just the best results in my experience in clinical practice. No burp back, no fishy indigestion burps. And unfortunately, a lot of those solvents can sometimes cause that in some people. Finally, last slide here on omega 3s, practical omega-3 tips. We already talked about triglyceride form. Look for things that are single source. Why? Because you're going to get the highest quality omega-3s instead of having a conglomerate of multiple different types of fish that are just thrown into the distillation process, some different levels of actually decomposition. Single source keeps it the purest. Uh, for example, things like anchovies are very, very low in any sort of contaminants and very high in omega 3s, where something like sardines, they're actually really, really potent. They're really smelly. While you can eat sardines, but in the omega 3 world, it has to be very deodorized, and the color of them is actually quite dark. So looking at single source, I think is superior. And then you want to find a solvent-free processing. Unfortunately, the reality, most omega-3s are manufactured using chemicals, and some chemical residues still stay in the omega-3s. This is why people get comes that indigestion. And it's not so much the omega-3s, a lot of it has to do with the chemical residues that could still be present. And so this is an example of one that actually does get up into the high EPA dose. So you can see this is a supplement panel. It does contain a little bit of vitamin D3. That's not the main benefit, but it's 800 IU. It's not nothing. It's something there that can help augment what you're taking. But the EPA for 4 soft gels, which is really the dose you need to get up to an evidence-based level, you have 26 or 2600 milligrams of EPA. Now, this would be something that would actually benefit your mood. Okay, so we talked about magnesium, we talked about vitamin D, we talked about omega 3s. We have to talk about two other things here quickly in the nutrients. This is one of the most common deficiencies on the planet, and that is iron. And that leads to, in worst case scenarios, anemia. And you can see there's a whole list of side effects and symptoms here. Frequent injuries, poor immunity, your thyroid doesn't work well, you can have restless legs. This is one of the most common sneaky signs of iron deficiency. And obviously, the most common one, you are tired. You can have fainting. You can have dizziness. You can have heart changes because your heart's trying to work harder. So there can be palpitations. So anemia is really, really common. It happens after blood loss. This can be tiny amounts. This very commonly can be heavy periods. Sometimes in pregnancy, you need extra levels of iron for pregnant women because they're making more blood for the fetus. A big one that's often overlooked is poor absorption. So any sort of inflammation of the gut. So if any of these things that I just mentioned, for example, if a person's had a part of their digestive system removed, if they have a bacterial infection, if you have gastritis, which is inflammation of the gut, if you have celiac disease, if any one of those things can impair absorption of all of your nutrients, including iron. You have to get your levels tested, and most doctors are pretty good at doing this. The main testing marker to look for is something called ferritin, and it is the most accurate form. Blood iron, or what's called serum iron, is not as sensitive, and it kind of goes up and down with what you've eaten recently. But ferritin is the first thing to start, and most labs are now smartened up and have a really good breakdown. Your doctor will help you navigate this. I strongly suggest if you are somebody that has blood work that looks like this, where you constantly have low red blood cells and low ferritin, and you've been trying iron supplementation and it's not getting better, you're having trouble absorbing it and tolerating it, work with a naturopathic doctor to figure out why that's the case. There's a lot of little nuances that have to be looked at, but iron is one of the most common things that can lead to poor mood, poor energy, and lots of symptoms that we talked about. Finally, in the micronutrient and I would say vitamin nutrient category is B vitamins. B12 is probably, as you saw on the previous slide, it's the one that's most often pointed out because it's easily tested. You can test B6, you can test folic acid, and those are deficiencies. In my experience, they are happening less often than B12. But in general, they work as a team, they work as a family. It is really common people that are vegetarian, that have history of veganism or vegetarian. Again, if you have intestinal damage, certain medications like metformin, which is a common medication for diabetes, is known to deplete B12. Some people need higher amounts of it. The simplest thing is to get your levels tested. What I've showed you here on this little panel from one of my patients' blood tests is that you can test B12 and 171 is just above the range, but it's still insufficient. Japan, for example, its range is over 500. So in Canada, we have a very low range, which actually, in my opinion, misses a lot of people that have insufficient B12 levels. It can also be double checked with something called homocysteine, which is not a common thing to test. But if you have trouble with B12 levels or you're wondering if your B12 levels are adequate, you can double check it with homocysteine, which is an extra paid for blood test, but it is quite accurate along with the vitamin serum B12 levels. So to conclude, what do we do in terms of supplementation with B vitamins? Just like magnesium, I'm not getting into all the nuances. We could spend 3 hours talking about each one of the B vitamins, but I do want to point out that there are better absorbed active forms, and I've listed them here in the right panel, in the right column. And good quality multi B complexes will have these active forms. You can get them individually as well. The benefits of these active forms is that they're absorbed better. They are more bioactive. They are going to give better, faster results on improving energy. Sometimes, if you're deficient in B vitamins and any of the nutrients I mentioned, when you start repleting them, you should start noticing a big improvement in your energy levels pretty quickly. Okay, to wrap up the deficiency section, I want to talk about light exposure. And you probably wondering, why did Dr. Paul throw this in to the deficiency category? Because I think especially we're doing this webinar at this time of the year. It's very dark outside. The days are quite short. People actually have a deficiency in light. Our brain runs on light. There's a thing called circadian rhythm or circadian pattern. And I love this diagram because it actually shows you in a wheel form, which kind of tells you that all these values, all these times are connected. So let's take a look at this time right now. We're approaching 8 o'clock. You can see that 8 p.m., you're starting to see that your melatonin is going to start being produced. So your melatonin starts around this time of the night, and then it's peaks and then goes down. You get the deepest sleep around 1 to 2 a.m. And then your body starts waking up as the opposite. So, one way to think about this is that your 8 p.m. or your 9 p.m. is similar but opposite to the 9 a.m. So, what you do in the morning, because your circadian pattern runs off light, it will set you up for later in the day. What do I mean by that? When you get light exposure during the morning, you will make more melatonin at night. If you have lots of light at night, synthetic lights, artificial lights, screens, computers, laptops, you can actually disrupt your melatonin production. So now that it's dark outside, what I often do is I'll put on one of these glasses like this. These are blue blocking glasses. These block the effects of the light that I'm being exposed to here on the screen. And it starts allowing my brain to tell all the different systems that are responsible for sleep to say it's actually time to go to bed. It's actually time to calm down. Light is the main thing that drives that. So the simplest thing is you got to get light in the morning. Natural light, at least 30 minutes a day, sometime between, when you wake up and 3 p.m. Try not to throw on sunglasses as soon as that you wake up. A lot of people I see driving their kids to work, their light sunglasses are on right away. So when you think about it, in the winter months, they get up, they get synthetic light in the morning or a little bit. They'll get into their car, they throw their sunglasses on, drive to work, get to their office, very minimal light there, get home when it's already dark, and they literally have no light. Now, if you live in a place that you just simply can't get enough light, what I'm just showing you here is one of my favorite things, which is actually a happy light. So this is something that can be used to augment natural light that ideally you should be getting in the morning. There's a number of different settings, but the research shows actually that you can get the benefits of the sun exposure by using one of these SAD or happy lights. And SAD stands for seasonal affective disorder, which is a way of describing people that feel depressed around this time of year. And if you get that regularly, that's now diagnosed as seasonal affective disorder. It's common for people to start feeling a little down or a little bit more tired or a little bit more demotivated around November and December in the northern hemisphere, but it shouldn't lead to depression. 15 to 30 minutes, about an arm's length away from you, off to the side, is enough to get these benefits. Better focus, better brain function, ultimately more focused, calm, and happy when you're exposed to light like this. One of my favorite herbs to support sleep and support kind of a calm nervous system is saffron. Saffron, just like the thing that you use to cook with, it gives you that rice, the really nice, beautiful golden color, has a lot of anti-inflammatory, antidepressant, and mood-enhancing effects. There's clinical studies on depression, anxiety, and sleep dysfunction, and I've posted a couple here. I'm not going to go into each all this detail, but it's one of the few things that does help with depression in the natural health world. Typically mild to moderate. It's not going to be great for severe depression. And always work with your healthcare provider to manage, if you actually have a clinical diagnosis. What I really like about saffron is that it's extremely well tolerated and there's very little interactions with medications. Unlike St. John's wort, which also is quite effective, St. John's wort is notorious for having interactions with different medications because it works on liver detox pathways and alters the elimination of those medications. Saffron doesn't seem to have that, and it's very simple at a very low dose, just taking 1 or 2 capsules a day. The evidence-based dose for saffron is around 30 milligrams. One of my other favorites is L-theanine. This is an amino acid that's naturally found in green tea. And much like saffron, it has a broad spectrum of effect. It helps dopamine and serotonin metabolism. It has an anti-inflammatory or anti-excitotoxic function. And you know what? One of the best things is that, again, like saffron, very safe. It's been studied in children, studied in conditions like insomnia, stress perception, ADHD, even, and it works really, really quickly. Unlike things like saffron and some of the other herbs we'll talk about at the end of this presentation, it works very fast. And so that's a real big bonus. Okay, so we've got through the two first sections. I want to just quickly touch on hormones. And I'm not going to spend too much time with it because honestly, again, it's worth probably hours of actual details. But I think it's worth talking about because, as you're going to see, hormones do play a really key role in allowing all these kind of stress and focus systems to work better. So, this is your overall graphic representation of your hormonal system. Just to kind of the things I'm going to be focusing on is your thyroid function, your brain as it communicates with your reproductive organs, and also your adrenal glands. Thyroid's really easy. Don't have to spend a lot of time on it. The main symptom is fatigue, but think of it like a thermostat. It's like if you turn your thermostat down to 15, it'd be cold. You're probably not going to feel, you're going to feel sluggish. You're not going to want to move around. Your joints will be stiff. The same analogy happens in your body. You're tired. No matter what you do, you're tired. You're constipated. There's weight gain that's happening. You can't lose weight. You get dry skin, coarse hair. You might even get low mood and depression. Everything kind of like slows to a crawl. It's quite easy. The reason I'm not spending time on it, it's quite easy to test. TSH is the main one. The ideal thing, though, is you need the TSH to be between 1 and 2.5. Oftentimes, the range on labs is higher. The solution is to get these tested. Also, ask for measurement of the thyroid hormones, which are called T3 and T4. Often, those are overlooked. They are part of the equation, and work with your doctor on that. And if you continue to have thyroid issues, double check autoimmune markers. This is called anti-thyroid peroxidase or anti-TPO. Your doctor will know what that is. That's another way of figuring out, do you have Hashimoto's, which is an autoimmune thyroid problem. Here's your reproductive hormones. And this is specifically talking to all the ladies at this point. So this is a typical pre-menopausal cycling women in her reproductive age. You have estrogen being the main hormone in the front half of the cycle, which is the yellow orange line here. Then you get the two spikes here of the LH and FSH. That's the signal to say, hey, ovulate. Progesterone goes up. We know ovulations happens. And estrogen goes down, and then the cycle repeats after somewhere between 25 and 30 days. This is the normal pattern. Uh, Hormones, as anyone knows, play a key role in mood. So it's not this pattern for someone can be quite symptomatic. Let's take a look at some of the influence here. Estrogen is very good at being cognitively focused. So imagination, memory, perception, muscle mass increasing. There's a lot of benefits. A woman, when she has kind of the estrogen spike that's happening, she generally feels more feminine. She might have higher libido, which is again why the sexual desire is the highest mid-cycle. That's all by design in terms of to facilitate reproduction. But on the flip side, she might be a little bit more anxious at this time, where progesterone has a more calming effect. And that's where progesterone dominates in the second half of the cycle. The uterine lining builds up, and progesterone is responsible for having a calming effect. And a woman may be more calmer. And then right around her period, where it happens at the end of the luteal phase, though both those hormones drop off, estrogen and progesterone, and you can get PMS. So if you have dysfunction in any one of these areas, ideally you should have no symptoms or very minimal symptoms. If you have dysfunction, pain, mood changes, sleep changes, cramping, bloating, these are all signs that there's hormonal imbalances. And they're affecting your mood, as most women will tell you. In menopause, you're going to see, obviously, now you're going to get a peak in these big brain hormones, the FSH and LH, and you're going to get a deficiency in estrogen and progesterone. But as you can see, it's a roller coaster. It's not a smooth ride. And there's a ton of mood changes that happen. Even the symptoms of hot flashes disrupt your sleep and dramatically change mood. This has been a huge seismic shift in medicine where we used to think that menopausal and perimenopausal women should just suffer through this transition. And any sort of hormone replacement therapy is actually detrimental. It's going to cause cancer risk. That's been debunked. It does still have a very minimal cancer risk, but it does not preclude women from getting the help that they need. So that's the big shift in the last 5 years. And this can be a huge influence on a person's health. And as you can see here, there's major symptoms with having deficiency in estrogen, which is the common thing that happens after menopause. It's connected to brain function. This is why brain fog is the number one symptom that women may get. Hot flashes is a huge one. Mood, anxiety issues. Deficiency in estrogen plays a lot more than just the typical vaginal dryness, hot flashes. It affects your brain. And on the flip side, you know, the yin and the yang of estrogen and progesterone, progesterone has a very calming effect. It works on the GABA receptor. So if you have trouble sleeping, and that's happened after menopause, if you're more anxious after menopause, it's most likely due with a deficiency in progesterone. And then finally, testosterone. This is a little bit for both men and women. It improves libido and sexual function in women and men, and of course has a key role in muscle mass in men, massively connected to depression. If you have low testosterone, it can lead to depression for men. And this is something that's often overlooked. Most of these men are medicated and not get the actual right treatment and root cause. So the solution for all the things I just talked about, because I unfortunately I'm not going to be speaking about all the different treatment options, is go get tested. If you're in these transitional periods, if you're, let's say, like menopause, or you're a cycling female that has symptoms that are changing your mood, they're influencing, you might say, oh, I'm for 14 days of the month, I feel great. And then I feel sad and I feel anxious and I feel terrible the rest of the time. And I have all these symptoms. Those are signs that you need to do some digging on hormone function. So work with your doctors, work with their naturopaths to figure out what's deficient and correct it using nutrients, botanicals, and even sometimes hormone replacement. The thing I'm going to finish off with here is one of my favorites systems that often gets overlooked is our stress coping system, or our HPA axis. Maybe you've heard of the adrenal system. Most people have heard of cortisol before. Cortisol is your main stress hormone. And so when you perceive stress through this pathway in the brain, pituitary gland stimulating the adrenals, out comes cortisol and adrenaline and epinephrine to combat that stress. Now the problem is that that's okay, but what if it becomes chronic? Well, now you're going to get problems with waking up at night because you're getting a cortisol dip and a spike. You might get fatigue with energy bursts. You might find you have a real tough time waking up. You might have anxiety. You might have weight gain around your midsection where most of your cortisol receptors are. And then you might find you're getting a second wind late at night after you've been dragging your butt the whole afternoon. These are all signs that cortisol is peaking and it's deficient at the wrong times. And then finally, the worst case scenario is that you have a deficient cortisol curve where you're really not getting those spikes and you're just generally tired all the time. So if you've ruled out iron deficiency, if you've ruled out all the other nutrient issues, if you've checked your thyroid and it's normal, if you're not going through major menopausal problems and you are still really, really tired, evaluate your sleep and then go after taking a look at your adrenals. And really, the only one that's good at treating adrenals is your naturopathic doctor. They're the ones that understand this really, really well. Okay, so a couple things I'm going to leave you with are some herbs that help with supporting adrenal function. Some of these you've heard of, I know. Ashwagandha. This is a great one for calming cortisol, decreasing cortisol. So it's better used as more of a sleep support, anti-stress, anti-anxiety. It calms a high cortisol that usually should be high in the morning, but it can become dysfunctional and start spiking later in the day. So this is a good one to use in the evening. Lots of good research showing improvement on sleep, stress, and anxiety. You can see cortisol levels right here going down. All these stress core levels, the light gray line is the ashwagandha supplementation. Around 600 milligrams seems to be the sweet spot. Rhodiola, this is kind of like a brain focused one. This improves dopamine, brain concentration, where ashwagandha calms. Rhodiola is more of a stimulator and really helpful for kind of like improved concentration. So that's where I wanted to include rhodiola because it's a more focused botanical. It affects again multiple neurotransmitters, dopamine, adrenaline, serotonin, and has research showing that improves concentration and again regulates cortisol. And then finally, Panax ginseng. This is the standard American or the Asian ginseng. Panax is the actually technically the Asian one. I included it here because it's actually one of the most researched adaptogens, and that's the family of herbs that help the body adapt to stress, often considered adrenal herbs. Um, Again, similar things. It's kind of like a broken record here. Supporting neurotransmitter function increases the function of cortisone, which is your body's anti-inflammatory adrenal hormone. Supports memory, particularly having an improved memory when it comes to alertness, secondary memory like recollection. It seems like that's when you're getting some of the benefit, and it seems to work quite quickly. Okay, so in summary, we talked about sleep, hormones, nutrient deficiencies. We did not have a chance to talk about the gut, so maybe we'll have to talk about that next time. We talked a little bit about diet, so don't forget these foundations. If you feel like I was talking a million miles a minute today and you missed a couple things, let's just refocus and just think about hydration, 3 to 4 liters, avoid those ultra processed foods, and cut back on sugar. This time of year, it's really easy to get stuck on that sugar roller coaster when you have those big spikes and then those crashes. The simplest thing is to start right with these 3 points and then go get some testing done. We talked about lots of different hormones and nutrients, most of which you can actually get some testing done. And then talk to your doctor if you get the basic testing done. Talk about maybe thyroid, adrenal function, if there's any hormonal symptoms that we talked about. And then if that's still an issue, maybe it's the fact that your sleep is dysfunctional. Do you have sleep apnea? Are you waking up in the middle of the night snoring or having a dry mouth? These are all things that will definitely impact your mood. So we definitely want to rule out the obstacles, and then obviously work with healthcare providers that have expertise in the psychological realm. This is obviously meant to be informational, but good foundations that we talked about here, addressing deficiencies, minimizing excesses, and balancing hormones. Okay, I'm going to turn it over to Cam and Sophie. I see that there were some questions. I'm going to stop my share and we will take a couple minutes, maybe 10 minutes here to answer the most important ones. But thank you for sticking with me. I felt like it was going a million miles a minute, but I feel like we covered most of what we had to.
Yeah. Well, thank you, Dr. Paul. I'm sure everyone really appreciated it. And we've seen some comments in the chat where they really thought this was an amazing presentation. I think everyone appreciates that you go over like the underlying mechanisms behind some of the dysfunction and not just, hey, you have this, do this. It makes adherence a little easier for people, I think. So thank you very
Thank
much.
you.
We do have some questions. So when talking about hydration, do they need to consider the alkalinity of the water?
Yeah, that's a good question. So, one of the things that kind of became really popular probably about 10, 15 years ago was drinking alkaline water. There's whole companies like Flow dedicated to drinking alkaline water. And I think that the concept of alkalinity and acidity is really important, but I do think it kind of gets overemphasized. What I mean by that, drinking alkaline water is a way that we can actually impact some of the alkalinity of our stomach, but it may not be getting actually into our cells, into our membrane. So where we really want to be alkaline, or another way of putting it, we don't want to be acidic in our cells and around our cells. No matter what, you will not change the acidity or alkalinity of your bloodstream. And that's where we lose a lot of our medical doctor colleagues, is because a lot of them just absolutely dismiss alkalinity and acidity conversation outright because they say, well, this is nonsense. The body regulates its pH. It regulates blood pH, but it absolutely, alkalinity and acidity can have an impact on what's going on inside your cells and around your cells, which is called the intercellular matrix. Now, you can use water as a tool to help augment that. But ultimately, the most alkalining things in your body are minerals. Minerals is what makes water either acidic or alkaline. Drinking and primarily eating a lot of acidic foods is going to cause your body to leach those minerals like calcium and magnesium, which are the two main alkalining minerals, along with potassium. And that's going to lead to a whole bunch of problems like heart issues and also bone problems. So I think water should be neutral, in my opinion, and that's why most spring water typically is. Maybe slightly alkaline, and the reason it's alkaline, like some of these like medicinal mineral waters, especially from different kind of spa places around the world, they have higher levels of what are called bicarbonates, and bicarbonates do have medicinal, like actual therapeutic benefits. But just drinking alkaline water by itself, some of these really expensive systems, I'm not so sure that that actually does what they think it does.
Cool. Thank you. We have a comment here, I suppose more of a question. It looks like someone is experiencing high ferritin in their test, but still has low hemoglobin.
Yeah. So this is one of those examples that you obviously have to work with your healthcare provider to figure out why that's the case. So um, most often, what I'll say right now is that there's a bunch of patterns that can be responsible for this. But most often in my clinical practice, what that reflects is Ferritin, when it's low, is very sensitive for iron deficiencies, Cameron. However, when it's high, it can mean a whole bunch of things. It can mean usually inflammation is the main reason. So, liver issues and inflammation. That's because when your body's inflamed, it will actually make more ferritin. Ferritin is a liver protein that carries around iron. Remember, it's not iron itself. So when you have that pattern, you can still be low in iron, but you have lots of inflammation. And then that is going to be problematic for a bunch of other reasons. You should also get your saturation tested. You should also get your iron tested. These are the actual more detailed values to double check are those levels low? If they are, that might confirm that you do have low iron, but the ferritin's being elevated by something else. Remember, ferritin's a storage protein that goes up and down with things like inflammation. It is a good, accurate marker when it's low, but when it's high, it can mean a bunch of things. It needs to be worked up ultimately. But
Great. Okay. We have another one here for you. Chronic fatigue, but they've noticed that when taking adaptogens, it actually makes them feel more tired rather than energized, especially the next day. Is this something that you've seen in practice with people with chronic fatigue or HPA axis dysregulation? And how do you determine if adaptogens are appropriate for these people?
yeah. So adaptogens, one of their claims of fame, Cam, is that they seem to be very well tolerated by most people. So there are some, I would say, rare examples that, like this person that asked this question, that it doesn't get that really good effect from adaptogens, the positive effect. Sometimes it may be to, what do adaptogens do? First of all, they're probably taking a multi-adaptogen formula. And now the issue is which one is the problem? What I'd strongly suggest is go individual and work with if you're getting the opposite response to an adaptogen, you may be pushing a pathway that actually is blocked up because of a deficiency. So remember that mitochondrial diagram I showed you right at the beginning of the presentation? Well, the adaptogen comes in, and what it does is that it helps with one particular aspect of it. But what if you're deficient in B12 or CoQ10 or a whole bunch of other factors? If you're deficient with that, especially chronic fatigue patients, they have mitochondrial problems at multiple different levels in that energy production chain. So if I just come in and start pushing on it, the people that have chronic fatigue and fibromyalgia, they're notorious for having poor reactions to supplements because of these metabolic, what are called log jams. So that's probably the simplest way I can explain it. You have to work with a healthcare provider to figure out, ultimately it'll be a naturopathic doctor or a functional medicine doctor to figure out what's that log jam. There's now testing coming out that can actually test mitochondrial function that will determine this log jam, or at least help the provider determine what the log jam is.
Nice. Well, just there are other comments just saying this has been amazing, very informative. They want to know when they can rewatch it. But aside from that, we have a question about when is the appropriate time to use potassium?
Yeah, so potassium is a nutrient, sorry, it's a mineral that's found in food. So again, for most people that eat a well-balanced diet, you should be getting enough potassium. Potassium is actually fairly easy to get in your diet, unlike magnesium, because things like avocados, potatoes, they're very rich in potassium. Coconut water is legendarily rich in potassium. Where magnesium, it's not as hard, not as easy to get. So you're looking at pumpkin seeds, and pumpkin seeds are a good little sprinkle, but they're not a staple. So if you eat good vegetables, good plant-based, quality foods, you're going to be just fine on potassium. I think the extra potassium comes in when you start having spasms in your muscles, when you start having palpitations, doing blood testing for potassium, along with just today with the patient that I saw earlier, I found deficient calcium levels. I mean, calcium, you'd think that it usually is pretty ubiquitous in the diet when people are consuming things like dairy products, and even like green leafy vegetables have calcium in it. But this person had low levels of red blood cell calcium. So it is possible, Cam, that can happen. And so test first, and then the key indications are I'm sweating a lot, I'm losing minerals, I'm getting kind of like jittery, I'm getting muscle spasms, maybe restless legs, and I'm getting heart issues. Those are the things that I'd be thinking about for potassium.
Nice. Okay, very thorough responses. I know we've taken up a lot of time. There's one last question, if you don't mind, Dr. Paul.
Yep.
This person has a diagnosis of fatty liver. Would that cause elevated ferritin?
It definitely would be on my list. Absolutely. Yeah. Something to think about as possibly leading to that. If it hasn't been fully worked up, is it just a mild fatty liver? Is it actually going into fibrosis? There are lots of tests that can be done, like a liver ultrasound. And then there's something called the FIB4 score, FIB4 score, that's now been used in practice in most standard tests. That would be something I would explore for sure. Remember, I said inflammation and then liver issues. Fatty liver is common though, so I don't want to like think everyone that has fatty liver is going to be symptomatic with high ferritins and high inflammation. No, that's not the case, but fatty liver is a massive underappreciated epidemic, I would say, and it can influence the production of some of these proteins.
Cool. Well, thank you so much. Of course, Dr. Paul and everyone who attended. I think that was very informative. A lot of thank yous in the chat there. They thought it was fantastic. So great job, and thank you
Yeah,
once
thank you
again.
for joining us, everybody. Appreciate everyone's attention. Great questions. The This webinar is recorded, and so you're gonna have to check in back with your Healthy Planet contact. I don't know exactly where they're gonna host it, but I'm sure that information will be available to you. Appreciate everyone's attention, and look forward to seeing you in the future.
Thank you so much.